When the pandemic broke out, we didn't wait to act. Knowing that Indigenous communities across Canada needed support to prevent and stop the spread of the virus, Canada acted fast. Today, Canada is announcing $650 million in additional funding to support Indigenous communities to prevent and respond to the COVID-19 pandemic and ensure that we are able to continue to react to the evolving needs of First Nations, Inuit and Metis communities. Of this, $285 million is in new funding to support the rapid and efficient public health response for Indigenous communities to the current COVID-19 pandemic. This funding has allowed us to respond quickly to health-related needs in communities across Canada. This meant increasing healthcare capacity and PPE stockpile, as well as supporting health needs in communities. The federal government has a responsibility to provide direct health care in some First Nation communities, and these funds enable us to live up to our obligation to provide quality care and support them, especially so in times of crisis. We were able to put in place emergency contracts for more nurses and paramedics in nursing stations and health centers that can provide guidance on the appropriate measures to prevent the spread of the virus and act quickly if a community member is affected. Overall, we are in a position to increase the number of healthcare professionals in nursing centers by up to 40% if needed. In addition, to date, we've sent 860 shipments of personal protective equipment, mainly to First Nations communities in Canada, but also to assist Inuit and some urban Indigenous communities. This is in addition to provinces and territories, as well as supplies from First Nations Health Authority in British Columbia. This funding will also support community-led initiatives to respond to the evolving situation, additional cleaning supplies and medical equipment, the adaptation of existing spaces to make them more appropriate for testing and treating the infection, and temporary structures that can be rapidly deployed where needed, providing additional space for isolation or accommodation where needed. I know everyone is concerned about the possibility of a second wave, and we are acting. This funding makes available additional support to communities on a needs basis for community-driven responses to First Nations, Inuit and Metis communities in the event of an outbreak of COVID-19 or a second wave.